My name's Will, and I'm a retired Brit living in Changsha, Hunan, China. This is both an update from July and a re-recording to improve the sound quality. I have no medical or scientific expertise, but I do follow what is regarded as the scientific consensus on the pandemic issues. Definitely not part of the conspiracy theories that seem to abound on social media. I have no access to Chinese statistics which are not available in the public domain. Most of my knowledge comes from following reputable experts, such as members of the UK independent SAGE, that is the Scientific Advisory Group for Emergencies, but the independent one, so independent of government and their interference. Also the Zoe Health Study and a few North American doctors. While I rely on experts, I've come to the conclusion that not all experts are equal. My criteria for assessing them boils down to a couple of subjects. Does their perspective and advice lead to lesser caution? Do they ignore dangerous aspects of the pandemic, particularly long COVID, where currently in the UK over 800,000 are living with this condition for over 12 months? And if yes, then their advice must be taken with caution and be regarded as suspect. They may, of course, still be correct on many things, but in this pandemic, we must seek to contain the pandemic and not be soft on the virus. China had a difficult spring this year. It had a terrible outbreak in Hong Kong, and everybody knows about the Omicron outbreak in Shanghai on the mainland. Things have come down a lot in Hong Kong, but of late cases have been going up. Currently, there are around 10,000 cases a day and 10 deaths. Shanghai, having had days of about 28,000 new cases back in March, are now down to single figures. Omicron arrived here in China at exactly the same time as in the UK, early December. While we've had two terrible outbreaks, it's not swept the whole of the country, largely thanks to the pandemic precautions which the Chinese authorities have put into place. However, by comparison, the UK has been devastated by Omicron in just 1 month. And this year they've had 3 waves in 6 months, and currently BA5 is likely to exceed the infections back in March or April. The difference? Precautions. The UK has abandoned all precautions bar vaccination, but that's pretty much at a standstill according to the stats. China, however, unlike pretty much every other country on the planet, has kept quarantine for the new arrivals, including new arrivals from other Chinese provinces, isolation of the infected, and universal precautionary messaging. Get vaccinated, wear good quality masks, especially indoors with your non-household members, social distancing, keeping the windows open, and it's not over. By comparison, the UK government declares it's leading the world in living with COVID, while at the same time ignoring that 50 or 60 people are dying every single day. Independent SAGE is very clear in stating that living with COVID must go hand in hand with precautions. The UK lives with 5 road deaths a day, but has restrictions like seatbelts, traffic lights, speed limits, car safety checks, sight tests. And yet with 60 deaths a day, it has zero restrictions. They even abandoned mask-wearing mandates in hospital. And to my knowledge, everyone in the hospital is there because they are sick. Catching COVID will only make their condition worse. To my horror, loads of hospitals and GP practices followed the government's advice, which included threats of naming and shaming. How come medics abandoned their principle of precaution? Here in Hunan, cases rose in the spring. At one time, the numbers currently infected rose to around 68. My singing classes were cancelled. Mask wearing, which was already standard practice, became 100%. Our electronic health cards showing vaccination data and recent tests needed to be scanned upon entering every building, even on buses. And at the peak, they were being tested every couple of days. Over a 9-week period, we were tested 9 times. The UK has abandoned free testing. You cannot even register a positive test from a paid lateral flow test. You only get tested for free upon being admitted to hospital, but that's coming to an end as well. Result? In Hunan, with a population of 66 million, not far short of the UK 68, we currently have 21 active cases, plus a few asymptomatic cases, all recorded from visitors from other Chinese provinces, going through quarantine facilities. And in our city, they've instituted a 7-day test criteria. We had our first of this series this morning. Yes, cases are rising slowly on the mainland. Currently, about 2,000 cases. That's in a population of 1.4 billion. But you cannot trust Chinese statistics, I hear you say. Sure, nobody in the West believes Chinese infection numbers, but they believe the horrors that Shanghai experienced. They believe the stringent precautionary measures and restrictions. Remember the stories of Xi'an back in January? My experience has been that restrictions brings down numbers. Low numbers means few restrictions. There's a certain logic to that. And there are a few academic studies that actually support Chinese stats. Read the New York Times article dated the 4th of February 2022 by David Lenhart entitled Zero COVID in China. Changsha is about 300 kilometers south of Wuhan. Back in the spring of 2020, 2 people died in my part of the city. But there was no official lockdown. Sure, it was the Chinese Spring Festival, so it was easier for people to stay at home, which is what they did. I never went outside my front door for 6 weeks. Yes, my wife went out every day to cook for her elderly parents. The buses normally come in every minute, but she had to wait 30 minutes for one to arrive, and then when it came, it was completely empty. She said the city centre was deserted. But there were other restrictions. No visitors permitted in your home, temperature monitoring at every shop and building. Result, Hunan had less than 3,000 cases total. Currently, the UK experiences 108,000 new cases just yesterday alone, and nearly 1.5 million current active cases, according to their Zoe Health study. While those numbers have been slowly rising over the last week, at least hospitalizations are falling. If China had been following the living with COVID example, exemplified by the UK and even suggested by the WHO, forecasters have predicted it might mean 1 million deaths. Currently, the West is complaining about chip shortages due to the Shanghai lockdowns. Can they imagine what a devastating effect living with COVID would have on the Chinese economy and by inference on the world economy? The reality is that China is the 21st century's workshop of the world. The West endlessly complained about China failing to stop the virus back in January 2020, when in fact little was known about the virus. And the very first death, according to WHO, was recorded on the 6th of January. Even the WHO put out a report on the 1st of February 2020 that asymptomatic infection was not a major factor. Later studies estimated that 85% of infections in Wuhan at that time were undiscovered, so presumably pre-symptomatic or asymptomatic. Yet Wuhan was totally shut down to the world on the 23rd of January that year. 0 flights, 0 trains, 0 cars, there were roadblocks. My wife's cousin, who lived in Wuhan, came to Changsha for the Spring Festival, travelling just a few hours before the lockdown. And by the end of May, the epidemic in Wuhan was effectively over. I expected the same in the UK, but no. It's still no. I was hoping to return for a relative's 100th birthday in July. No chance. I doubt I'll be able to visit until next year. I've already put it off 2 years. I've recently had a dialogue with some Westerners in Hong Kong, complaining about restrictions and longing for the freedom of living with COVID. I'm sorry, but such perspective is thoroughly dangerous and flies in the face of reality. COVID is not just a cold. Thankfully, if you're fully vaccinated and without other health conditions, you'll probably survive. But I have healthy young friends in the UK who tell me it's been terrible. In fact, I now have a list of over 30 friends who've had it in the UK. My extrovert Chinese wife, by comparison, doesn't know a single person here in China who's been affected. And then there's long COVID. Even those found to be asymptomatic are experiencing a much greater incidence of type 2 diabetes 1 year later on. And things are getting worse. R0 for BA5 is around 18. Roughly, that means every infected person is likely to infect another 18 people on average. The original Wuhan strain had an R0 of about 3.3. It's much more transmissible, even outside. We cannot afford to live in some cloud cuckoo land and pretend that we can live with it without precautions. That just prolongs the agony for everybody. It's not over for anyone until it's over for everyone. Please keep safe.